In this video, we'll discuss about gastritis. Inflammation of the gastric mucosa is known as gastritis. Here, not ulcer, inflammation. So, inflammation of the gastric mucosa. There are two types, acute and chronic. Acute gastritis is mucosal injury associated with neutrophilic infiltration. Important causes: heavy use of non-steroidal anti-inflammatory drugs. Others are ischemia, alcohol, severe stress, uremia, like that. But the main cause is heavy use of non-steroidal anti-inflammatory drugs. If you take too much painkiller, it causes acute gastritis. These are the some other reasons causing acute gastritis: ischemia, alcohol, severe stress, uremia, like that. But main causes because of heavy use of non-steroidal anti-inflammatory drugs. Grossly, gastric mucosa is edematous with abundant mucus and hemorrhagic spot. Microscopically, edema, then it have neutrophil mucosa sludged off their hemorrhage on their surface. This is mucosa entire surface. Here neutrophil is presented. And comparing acute chronic is more important. Second important one, chronic gastritis. Presence of chronic mucosal inflammatory changes leading to mucosal atrophy and intestinal metaplasia. So, presence of chronic mucosal inflammatory changes leading to mucosal atrophy and intestinal metaplasia. Causes: main causes H. pylori and autoimmune disorder. Other reason: alcohol, granulomatous condition, radiation, but main because of H. pylori and autoimmune disorders. Next, types of gastritis. Type A and type B is most common. Type A because of autoimmune disorder. Type B because of bacterium H. pylori. Type 3, type A and B. This one is the mixed one. Type A because of autoimmune. Type B because of bacteria H. pylori. Type A and B mixed one. First, we'll discuss about type A gastritis. It is also called as autoimmune gastritis due to the presence of circulating antibodies. What happened here? This one associated with other autoimmune disease such as thyroid and addition disease. This is stomach. It having various type of cell. Parental cell is presented. This cell is important for secretion of two things. One is HCl, another one is intrinsic factor. Both these two things are important for observation of vitamin B12. But because of autoimmune disorder, this parental cell destroyed. Now the body will form antibody against our body produced antibody against this parental cell. So this parental cell destroyed. It causes atrophy. So first picture, it causes atrophy. So here less amount of or no HCl secretion. So it causes loss of HCl. It causes achlorhydria or hypoachlorhydria. Then vitamin B12 deficiency causes anemia, pernicious anemia or megaloblastic anemia. So three important features. First one is This parental cell destroyed, it causes atrophy. Second one is HCl less or not secreted, so it causes achlororrhea or hypoachlororrhea. Then vitamin B12 deficiency causes anemia, Persinius anemia or megaloblastic anemia. What is the cause? Because of antibody formed against this parental cell. Antibody formed against the parental cell. So three pictures. One is atrophy, second one is achlorrhea, third one is pernicious or megaloblastic anemia. So this one only, autoantibody against the parental cell. Then gastric, it can leads to gastric atrophy or decreased in intrinsic factor. So because of this gastric atrophy, it causes hypoachlororrhea or achlororrhea or pernicious. Because of this intrinsic factor, pernicious anemia. Then second one is type B, because of H. pylori, commonly due to infection with H. pylori, also called hypersecretory gastritis, due to excessive secretion of acid. Here high amount of HCl secretion, there less amount of HCl secretion. So this patient associated with peptic ulcer. Here no autoimmune disorder. Here because of bacteria it causes ulcer. Here stomach here H. pylori will enter. Various cells of stomach, here no antibody secretion. When this H. pylori will enter, high amount of HCl secretion. More HCl is the aggressive factor, that means damaging factor. So it breaks that mucosa, so it causes, here it bridge that mucosa, here here it affected that mucosa layer, so it causes peptic ulcer. What is most common site? This is the stomach. It having 5 portion of that stomach. First one is pancreas, second one is cardia, third one is body, fourth one is antrum, fifth one is phylorus. So this 5 portion. A occur in B. A means autoimmune, occur in body, B occur in antrum. So A occur in B, B occur in A. Location H. pylori associated here, antrum, here body. Then serology, autoantibodies here because of H. pylori. Then gastrin level here decrease, here increase. Gastrin level here decrease, here increase. Then here associated disease pernicious anemia. Here it associated with anemia. Here peptic ulcer because of bacteria.